Hello, welcome back to my channel. Today in this video, we are going to see the gross anatomy spotting questions usually asked for practical examinations. If you are first time in this channel, please do subscribe. Come, let's get into the video. Identify the pin structure, give its insertion and nerve supply. The pinned structure is deltoid muscle, and the deltoid muscle is inserted onto the deltoid tuberosity of humerus and is supplied by axillary nerve. Identify the pin structure, give its insertion and nerve supply. You are seeing the posterior aspect of the arm, and the pinned muscle is triceps brachii, which is inserted onto the posterior surface of the olecranon process of ulna, and the nerve which supply is the radial nerve. The next question, identify the pin structure, give its insertion and nerve supply. The pinned structure is biceps brachii muscle, and the muscle is inserted onto the posterior smooth part of radial tuberosity and is supplied by musculocutaneous nerve. Identify the tied structure, give its root value. The tied structure is median nerve, and the root value is C5, C6, C7, C8 and T1. Next, identify the tied structure. Again, the tied structure is median nerve. So here also they can ask the root value. Again, one more question can be asked at the site. You are seeing the median nerve at the wrist. So compression of the median nerve at the wrist or in the carpal tunnel leads to a syndrome that is known as the carpal tunnel syndrome. The question can be asked like this: compression of this nerve at the site leads to what syndrome? So the answer is carpal tunnel syndrome. Identify the tied structure, give its root value. The tied structure is ulnar nerve behind the medial epicondyle of humerus. So you are seeing the ulnar nerve behind the medial epicondyle of humerus, and the root value is C7, C8 and T1. Identify the tied structure, give its terminal branches. The tied structure is brachial artery. In the cubital fossa, the brachial artery ends by dividing into radial and ulnar artery. So the terminal branches are radial and ulnar arteries. So these are some of the gross anatomy spotting questions normally asked for practical examinations.